Hello and welcome. I'm Bons Magsambol, and this is Rappler Talk. In just a month after the Department of Health confirmed the third case of coronavirus in the country, the number of cases in the Philippines continue to rise. As of Monday noon, March 23, the Philippines has 396 cases of coronavirus. Of this number, 33 have died and 18 have recovered. What is life like for a coronavirus positive individual? Joining us today is COVID-19 patient number 4, Sir Carlo Navarro. Hello, Sir Carlo. Welcome to Rappler.
Good afternoon, Bonds. Thanks for this interview.
Opo. So, Sir, kumusta na po kayo ngayon?
Eto, nagpapalakas sa bahay. I was discharged from the hospital 3 days ago while waiting for the results of my tests. Medyo clogged daw yung RITM. So I couldn't wait anymore. Pero since my doctor cleared me na my pneumonia has improved and I don't have symptoms anymore, so he actually said that I can go out of the hospital. We also did that because there are a lot of people who kailangan nila yung hospital room. And I was already strong enough to go out and take care of myself.
Ayun. So sir, maybe you can clarify lang din kung bakit kayo pinayagan ng lumabas ng doctor nyo. Like nakapag-test na kayo ng isa na nag-negative na, right?
Wala pang lumalabas na negative test results. Kasi nga dalawa yon test results from RITM hanggang ngayon hindi pa siya lumalabas. Okay. So I do not know yet. Wala pang confirmatory test na. It says a negative. But the doctor said he doesn't see any risks for me to go out anymore. Okay. Although I'm still in quarantine. So until the test results come out, I don't think I should go out. So even my family, they are still in the other house. I'm still here isolated. We are 20 meters apart. So walang contact with anyone, not even my dogs. So yeah.
Ayun, so klaro na safe na si Sir kaya siya lumabas na-discharge na sa hospital. So Sir, balikan naman natin yung naging journey nyo fighting the virus para lang magkaroon ng glimpse yung viewers natin kung ano ba yung buhay ng nagkaroon ng coronavirus. No, sir. So siguro, sir, start natin siya with how you got infected.
Sure. So, my family and I went on vacation to Japan. And then on February 25, we took the flight back to Manila. And merong tao sa likod ko na ubo ng ubo. Kasi nung nasa Japan naman kami, wala kaming naging contact na may umuubo or sinisipon. Malayo talaga lagi kami sa tao, naka-mask kami, naka-surgical gloves, buhos kami ng buhos ng alcohol. So I don't think we got it in Japan. But it wasn't, yung pauwi na kaming papuntang Pilipinas, meron ng lalaki sa likod ko, ubo siya ng ubo. Walang tigil. And then my daughter said, Dad, you have to go, you have to go to another row or you sit in another seat. Kasi mukhang, hindi ako makalis kasi pa-take off pa lang yung eroplano. Okay. And so after the plane took off, saka lang ako nakalipat. But I think I already got it.
Got it.
Then 7 days later, lumabas na yung mga symptoms. Meron na akong nag-chill na ako. And medyo tawag dito, may lagnat na ako ng konti at medyo nananakit na yung katawan ko. And yung ubo ko, mahirap maganit, hindi ako makaubo ng ayos. Talagang maganit na maganit. That was the evening, mga 9:30 in the evening, nung March 3. So March 4, immediately nagpunta ako sa St. Luke's BGC. And that's when they tested me. Tapos that night, mga 10:30 or 11 ng gabi, mabilis pa nun kasi wala pang ang case na tinetest. Lumabas agad yung results ko. DOH told me na, I need to be brought to RITM. Ayaw pa nilang sabihin sa akin nung una na positive ako kasi baka daw mag-resist ako. Sabi ko, no, I won't resist. I actually wanted to be confined kasi we do not know how to handle this virus. And then
Opo.
and my daughter and the house help will be exposed kasi although nung nagkaroon ako ng symptoms, pinalipat ko agad sila doon sa isang bahay sa BGC.
Mm-mm.
So, malayo na sila sa akin. Pero yun nga, so, and then that night, I also had my daughter and the maids and drivers. And then the following day, my wife tested by DOH.
Okay.
It turned out negative naman silang
Negative.
lahat. Ako lang yung positive. And then I was brought to, nadala ako sa RITM. And I spent 8 days in RITM.
ITM. Okay. So sir, what was going through your mind when you learned that you were positive of the virus? Natakot ba kayo na baka it might be the end?
Well, the first thing that went to my mind nung kausap ko yung DOH doctor, sabi ko sa kanila, I think you need to change your policy kasi ang policy ninyo is not to test unless yung person traveled from a hotspot country. And I think we're taking too much risk by not testing people. Kasi kung ako hindi na test, I would still be walking outside in BGC. But good thing I insisted to be tested. That was the first, and the doctor agreed. And I think that caused the change in their policy. So they started testing a lot. And if you look at it, 3 days after I got admitted, pumutok na. Sobrang dami ng nagiging positive. And then the second thing was, I made sure na yung anak ko at saka yung yaya na kasama ko dun sa bahay namin got tested that night kasi sila lang yung nando dun eh. So they got tested that evening. And then hanggang hindi naman ako natakot na mamatay kasi inisip ko na na I lived na very healthy naman yung aking lifestyle. And I know my immune system was strong enough to withstand the virus. And I was thinking, bata naman ako, hindi naman ako dun sa risk group. So, although I still took a lot of precautions, kahit hindi ako part of the risk group, I would still encourage everybody, kaya bata kayo, na stay away, isolate yourself, you quarantine. Kasi if you get it and then you pass it to the elderly people in your family, you are actually putting them at risk.
Actually. So sir, bigyan mo naman kami ng glimpse on the initial procedure that was done to you when you were admitted at the RITM.
So when I got there sa RITM, medyo doon ako natakot kasi lahat sila naka-hazmat, completely covered. Hindi talaga sila lumalapit sa akin. And then they brought me to the room. And then nung pagpasok ko sa room, ako pa lang siguro yung una eh. At saka yung isang guy na galing sa Green Hills. Pero nasa ICU siya kasi nga critical yung condition niya. We were the first two in the hospital. And then I think yung number 6, yung asawa ni number 5.
5, yeah.
Dinala rin siya doon. So when I got to the hospital, medyo nakakatakot kasi it's really deserted. Kahit yung nurse station, walang tao, walang except yung nagdala sa akin sa room. And then when I was there, they would draw blood every day to check kung may mga nagbubuong mga bacteria or sa katawan ko and whether there is any sign of pneumonia. So for the first 5 days, wala naman. They were saying that my blood tests are okay. But they test me every other day for COVID-19. And the test results came out always positive. So in the 5th day, when they checked my blood again, they said there was a bacteria that low level of bacteria that was probably will cause pneumonia. So that evening they x-rayed me. Nung nag-x-ray na the following day, na-confirm nga meron na akong hospital acquired pneumonia. And then yung ubo ko lumalala. And then I had diarrhea. And I was vomiting lahat ng kinakain ko. So, medyo natakot na ako at that point in time. Kasi nga, I was not improving and I was deteriorating. And at that point, I was transferred to a private hospital. 8th day ko na yon sa and I also heard that a lot of people died in RITM.
RITM.
When that's what the nurses told me.
Okay.
So finally, my sister-in-law, who is a doctor, was able to find another doctor who was willing to take me in. So then they transferred me that same day to another private hospital in Santa Mesa.
Mm-mm.
And then, but when I got to that hospital, the doctor said that he thinks that my case has already been improving. Kasi the following day, I had
Okay.
a CT scan. And then when I look at the CT scan, wala na daw consolidation dun sa aking pneumonia.
Pneumonia.
Meaning, nag-stop na siya.
Mm.
So, I got a lot better.
Okay. So sir, can you still recall kung gaano karaming tests, COVID-19 tests yung ginawa sa inyo since you were admitted?
I probably went through 5 to 6 tests.
Five
Yung
to
dalawang,
six tests.
yung dalawang huli, hindi pa lumalabas yung
Labas.
results.
Ito yung inaantay nyo ngayon, ano, sir?
Yeah.
Okay. So, sir, maybe you can shed light then on the issue, on the importance of being taken care of under a hospital facility.
Yeah, if you feel that you have symptoms, you need to get yourself tested. That's the only way you can have confirmation. Kasi if you don't get yourself tested, you might be spreading the virus to the people in your family who are at risk. Second, when you need to get admitted to the hospital, huwag kayong matakot kasi hindi nyo alam kung paano lalabanan ng virus unless may medical assistance yan. So kaya nagpapasalamat ako dun sa mga nurses at doctors na alam ko na very busy sila noon na halos hindi na daw sila natutulog, and meron mga times nga na yung pagkain namin dumarating ng late na kasi hindi nila madala yung mga pagkain namin. Inuuna nila yung mga tao na mas nangangailangan ng tulong at mas critical. So we fully understood, and that's why you need to go and ask for that medical assistance. Hindi nyo pwedeng itago yan sa bahay ninyo. Huwag kayong matakot na mahawaan kayo ng virus kasi meron na kayo eh. You're actually helping your family by going to the hospital and getting treated in the hospital.
Ayun. So, sir, sa 2 weeks na naka-isolate kayo sa family nyo, pwede nyo po ba kaming bigyan ng idea kung ano yung pinagkakaabalahan nyo? How you were holding up sa isolation na yon?
So, nung nasa hospital ako, yung asawa ko, pagising ko pa lang, magvi-video call na kami. Sinisigurado niyang umiinom ako ng tubig every 30 minutes. Umiinom ako ng yung mga immune booster na mga drinks. Lahat binigay niya yun sa akin. Then with a video call, make sure that I eat. Hindi lang niya alam na pagkakain ko, after nababa na yung telepono, diretso ako sa restroom and then I will vomit. Kasi ano na. And then sa gabi, merong pastor, si Diwa Gunigondo, and yung kanyang asawa na si Apple Gunigondo, would call me and we will pray for a good 20 minutes. They will pray and will ask for whatever I want to ask that day. So I guess the prayers of people and the constant calls of loved ones, that helped me a lot to go through the experience.
Ayun. And then sir, parang nabanggit nyo din dun sa post nyo na parang you were praying na sana mag-negative yung results ng family nyo. Kasi parang do you think na hindi sila magsusurvive sa RITM? Can you elaborate on that, sir? Paano nyo po nasabi yon?
Yeah, kasi nung pagdating namin sa RITM, understaffed talaga sila. And I fully understand kasi nga ang dami na nang dumadami na yung mga pasyente. And yung mga pagkain nga dumadating na ng late, and then yung mga gamot nyo. So sabi ko, baka hindi kayanin ng asawa ko at anak ito. Lalo na yung anak ko kasi mahirap kasi ikaw lahat ang gagawa. Ikaw yung magbibihis, ikaw yung magpapakain sa sarili mo. Pag hindi niya gusto yung pagkain, mahihirapan siya. So those things went through my mind. And then yun nga, yung sa gabi, biglang magigising ka, may umiiyak kasi may namatay dun sa katabi mo. Sabi ko, pag nadala dito yung asawa ko at anak ko, baka hindi na nakayanin yung fear. Kaya sabi ko, sana mag-negative sila. And then kung magpa-positive man, dapat siguro sa private hospital para para may sufficient na mga nurses na magbibigay ng attention sa'yo. Kasi nung nasa RITM, minsan pag pumapasok yung nurse, they actually apologize for bringing the food late. Sabi ko, huwag kayong mag-alala, I understand. Alam kong dapat yung mas maraming unahin na mas critical na pasyente. Pag tinatanong ko, dadalawa daw sila, and then they have to take care of a lot of us in RITM.
Okay. So sir, can you describe naman kung ano yung laman ng room, kung saan kayo nagstay?
Yeah, it's just a simple bed. Merong isang kama na lang, ganyan.
Mm-mm.
Pero may toilet kang sarili mo. So yun lang, ganun lang kasimple. Maliit
Ganun lang
siya.
kasimple.
Oo.
And then, ayun. So sir, may mga nagtatanong kasi sa social media kung magkano daw yung nagastos nyo sa whole treatment.
Sa RITM, libre siya lahat kasi it's a
Okay.
government facility.
Mm-mm.
So, pero nung lumipat ako sa private hospital, yan, medyo may charges na yan kasi may bayad na yung doktor, may bayad na yung facilities and everything. Hindi siya kamahalan kasi parang yung SSS and even my medical insurance, they have anticipated this and they covered most of the expenses. So almost more than half of the expenses got covered. So I was with that private hospital for 7 days, and the bill that I received was only around 60,000 pesos. But most of that bill was covered by medical insurance.
Okay, great. So ito naman sir, given the fact na wala pa pong gamot yung COVID-19 ngayon, ano sir yung may i-recommend nyo sa mga pasyente na may virus para madali silang makarecover? Kagaya nyo.
Actually, when I was there, they were giving me chloroquine and Sinicod. Yung chloroquine, if you could look at the news na lumalabas sa US, it seems to help COVID-19 patients, no? So I'm not too sure if that helped me, but that was what I took during those times. And then pag may lagnat ako, I took paracetamol to bring down yung init ng katawan. But I think what's important is you drink a lot of water, drink a lot of vitamin C. So nung nandoon ako, talagang galon-galon ng tubig ang inuubos ko. And then I kept on taking a lot of vitamin C, and then I think that those helped me a lot.
So sir, for my next question, how do you think is the Philippine government is handling this outbreak? What do you think can be done to improve their response?
From my experience, kasi they were very fast when they were very fast in determining my condition that I was positive. They immediately isolated me. I in fact followed up with DOH if they have contact traced, if they have reached out to all the people that I got in contact with, and have they been tested? They confirmed that yes, they have reached out to those people, and then they have been tested, and all of them tested negative. So that was the first day kasi. I was the first COVID patient, as you know. So noon mabilis pa talaga yung gobyerno. So ngayong dumadami na yung cases, I think our government needs a lot of help. I think people should volunteer to be tested. Hindi na dapat sila hinahanap ng DOH. Kasi it's nahihirapan pag yung mga tao nagtatago dahil ayaw nilang magpa-test. Ayaw nilang madala sa hospital. Number 2, we need to help those doctors. Kasi kung kailangan yung pang-unawa mo habang nasa hospital ka, is always broad enough to understand why there was insufficiency in care and attention. Wala tayong magagawa talagang mahirap. Hindi sila makapasok sa iyo kasi baka mahawaan mo pa siya. So at the same time, they need to take care of you. So talagang pakiusap ko sa mga tao, when you get in front of those medical practitioners, just be very honest. Don't hide anything. Kasi if you hide something, you're actually putting people at risk. The people who are taking care of you and those doctors and nurses are being at risk as well.
So, sir, do you think ba there's anything that the government can do to improve their response naman?
I think they should strictly enforce the lockdown. I think people should really stay inside the house until this virus is gone. Um, and I think there should be more transparency in the government as well, like sharing sufficient information to the public to make sure that the public understands and are well informed on how to fight the virus.
Okay. So, sir, to wrap up our discussion what is your message to all the patients fighting the virus?
To all the patients out there, this is something that you can handle. It will have to start from your spiritually and then mentally. Kasi you need to be strong. You need to believe that you can heal. Then there is a positive result to this. So you need to do that. Second, always be in touch with your loved ones. Because your loved ones will give you that positive energy to survive. So if you don't have anyone who's close to you, find your best friend or your pet or whatever.
Mm-mm.
Talk to them. Kasi it's important that you maintain your sanity while inside confinement.
And then what is your message to the healthcare workers here in the Philippines?
Maraming salamat po. Kasi I would not have survived that ordeal had you not took care of us. It's had you not taken care of us. There were days na alam ko na pagod na kayo, and but still, you touched our lives. In fact, natuwa nga ako dun sa isang nurse na even after I was discharged, she kept on texting me. Lagi akong kinukumusta na sabi niya, "Sir, kumusta na kayo? Sana lumakas na kayo," ganyan. Si Jillian yon ng RITM. So nung nung na-discharge na ako from RITM, tinetext pa rin niya ako, "Sir, si Jillian to, ako yung kanina, ganyan. Sana mag-improve na yung health ninyo, ganyan. So I really appreciate those gestures. And sana lahat kayo ay you stay healthy. Huwag kayo magpapakontaminate ng virus kasi kailangan kayo ng ating mga kababayan.
So, that's all for today. Thank you so much, Sir Carlo, for joining us. Follow our coverage of the coronavirus on rappler.com/coronavirus. Once again, I am Bons Magsambol, and this has been Rappler Talk.